It is also called as acid fast staining, alcohol fast staining. Although Mycobacterium tuberculosis Mycobacterium tuberculosis. Earlier they thought it to be a fungi. That's why they called it as myco. And it fulfilled all the criteria of pox. It became bacterium. Tuberculosis is a lesion. What is it? Lesion. Tuberculosis. What it contains? It contains central area of caseation necrosis. Central area, everybody. Central area of caseation necrosis. Surrounded by monocytes, macrophages, and there is a special giant cell, Langhans giant cell. Langhans special giant cell called Langhans giant cell. Langhans giant cell. So wherever you see a tubercle lesion, you see a chronic granulomatous lesion called tubercle. Chronic granulomatous lesion called tubercle. Tubercle. Tubercle consists of central area of caseation necrosis surrounded by monocyte and macrophages. There is a special giant cell called Langhans giant cell. One more acid fast organism is Mycobacterium leprae. It causes leprosy. What is leprosy? It is mycobacterial neurodermatitis. It infects the nerves and the skin. And lot of people do not treat leprosy. They think it is contagious. No, it's not true. Because seen Mother Teresa, Mahatma Gandhi used to stay in leper colonies to take care of lepers. So leprosy is one of the treatable infections. Now good drugs have come, dapsone, then rifampicin, all anti-leprosy drugs are good. It's totally treatable disease. A lot of people do not take treatment and go and take up begging. Okay, Mycobacterium tuberculosis and Mycobacterium leprosy. Although both of them are gram positive, they are not stained with gram staining because they have thick fatty layer which is made up of lipid layer called mycolic acid. They have thick lipid layer in the cell wall called mycolic acid. So they are not easily stained by gram stain. Special stain what we use is Zeal-Nielsen staining. Zeal-Nielsen staining. So yes, Zeal-Nielsen technique is special stain as well as differential stain. Special stain as well as differential stain. It is everybody. It is called special stain. It stains the special character of Mycobacterium tuberculosis, that is acid fastness. It is also called differential stain It differentiates between acid-fast staining and non-acid-fast organism. Procedure. Okay. It is how many steps? 3-step procedure. How many steps? So remember it as CAM, whereas grams is VIAC, 4. How many gram staining is? 4-step. Zeal-Nielsen staining is 3-step procedure. How many steps? So you are given a smear. Usually it is sputum smear. Usually it is a sputum smear. It is fixed. On that we have written Zn staining. Okay. Zn staining. The first step is cover the smear. Everybody cover the smear. Concentrated carbamazepine. Cover the smear with concentrated carbamazepine. Because it has a thick mycolic acid in the cell wall, the dye will not easily get into the cytoplasm. So for that you have to heat it. Heat it intermittently. Heat it intermittently for 5 to 7 minutes. Taking care not to burn, char or break the slide. Taking care not to burn, char or blacken or break the slide. After 7 minutes, decolorize. With 20% hydrochloric acid or sulfuric acid. Decolorize with sulfuric acid, drop by drop until faint color remains. Drop by drop until faint color remains. Counter stain. What? Counter stain. Counter stain with methylene blue. Counter stain with methylene blue for 30 to 50 seconds. Counter stain, everybody, counter stain with methylene blue for 30 to 50 seconds. Wash, 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 blot dry, see under oil immersion microscope. Adjustment of a microscope under oil immersion are full light, diaphragm fully open. So you have to touch the 100x objective. Okay. Sometimes people in examination they focus in 10x, 40x, and then when they don't see, call the help of technician. You have to touch the 100 is the actual objective. There are two adjustment, coarse and fine adjustment. So you lift up. Remember, everybody touch the slide up until you see something. Once you start seeing something with fine adjustment, you adjust the slide. So once you see this thing, bacilli, and final the product should be It should be blue in color. What color? Blue. It should be in blue color. Okay. Beg, borrow, steal some. You have to write nice ring. What? Nice. How many types of rings are there? Marriage ring, breakup ring, divorce ring. So many rings are there. Don't know. Unfortunately, divorce ring comes before marriage in dictionary. Okay. Now you have to draw the diagram. Uh, it is a pink bacilli. Pink bacilli. Everybody, long, slender, slightly curved, beaded, branching, pink, acid fast, bacilli, morphologically resembling Mycobacterium tuberculosis. Mycobacterium tuberculosis. Mycobacterium. If you do not know the spelling of Z-lens staining, just write Zn staining. Okay. Draw the diagram, write the report, and after that, what you'll do in examination? What you'll do in examination? You have to raise your hand. Sir, I have finished Z-lens staining. How do you do? Raise your hand like this. Ah, very good. Don't call the technician or assistant professor or help. Sir, just see, sir, is it correct or not? And he'll also. Then you'll get tensed up. Call the examiner. I am there, no. My hona. Okay. Chalo. Then, once you write that, then don't write any procedure in the examination. Okay. Just stay in it, write the observation and report. Okay. Examiner will come. Examiner will come. Examiner will come. What he will do? Examiner will come. What he will do? What he will do? First he will look at you like this. Some people will be wearing very old, shitty apron. All over stains. होली का रंग इधर सब है, उधर मुंह में थोड़ा कलर. So why you are wearing such a dirty apron? No sir, with this apron I went to dissection, I passed anatomy, I am keeping this covered in the corner. This apron I am going to wear in final year practical also. Very good. Always when you come to the examination, neatly shaven, dry cleaned apron, put some perfume. Ladies, not X, lot of mosquitoes will come. Okay. Ladies, when you don't know also give smile, you'll get extra marks. Okay. So nice, our best, you try to practice in mirror. How you do best you can see. So if you try your as soon as you put us up nice makeup, try to smile in the mirror and how good you look at. Start appreciating yourself. That builds self-confidence. What? Self-confidence. That's very important. And it's very important. That's very important. And be confident in the examination. रोती सूरत को कोई कोई मार्क्स नहीं देता. If you put on. Yesterday I did not sleep, sir. So, and external examiner will look at me as if I'm a villain. I have not taught anything. What? They don't know. They are not answering. What is happening? Sir, they are good, sir. Yesterday, they must have gone to some party or something. चलो लगा. हमारा बच्चों को हम ये संभालना पड़ता है ना. Whatever you are our children after all. Okay. Now he will look at you like this and give the best possible confident appearance. It's like a photo shooting. Yes. No, sometimes students, when a question is asked, so they will be looking at other people. What that examiner will asking some questions which these people will not be knowing. That time, some people will be carrying chits. No. Don't do anything. Okay. First question they will ask why they are acid fast. Your example and answer should be mycolic acid. Why they are acid fast? Your answer should be because they have lipoidal layer in the cell wall which is made up of mycolic acid. They are acid fast, sir. Very good. Then next question is asked, what are other acid fast organisms? Then you say Mycobacterium leprae. You have to say Mycobacterium leprae. Then they will ask, what are the differences between Mycobacterium tuberculosis and Mycobacterium leprae? Your answer should come. At least couple of answers should come now. We don't have time to ask detail. Okay. This is long, slender, slightly curved, beaded appearance. Long, slender, slightly curved, beaded appearance. This is short, stumpy, looks like cigar bundle appearance. Remember Amitabh Bachchan, Jaya Bhaduri. Tuberculosis is Amitabh Bachchan. Mycobacterium leprae is Jaya Bhaduri. Nobody, I think, seen. Now, Kavan Padeka Karorpati, anybody saying? Yes or no? Play along. You should play along. Download the app, you can play along, you can win prizes. Okay. This is 20% acid fast. How much? This is 5% acid fast. Okay. It can be the sputum is the sample. Sputum is here it is skin scraping. Skin scraping. Here it can be grown in LJ medium. So LJ medium consists of beaten egg, aspergine, malachite green, mineral salt, sterilized by inspissation, partial sterilization, tyndallization, 80 degrees for 3 successive days. First day, all vegetative forms are killed. Second day, spores will transform into vegetative form. They get killed. Spores are transformed into vegetative forms. They get killed. Third day, as a safety measure. That's about, and colonies will appear after 8 weeks. How many weeks? Once I went and asked after how many days the colonies will come, Mycobacterium tuberculosis. First he said for 48 hours. I said the increase. He said 3 days. Increase. I said 5 days. Little increase. No, sir, this is my limit. I cannot increase more than that. It is 8 weeks. How much? 6 to 8 weeks. Because generation time is 20 hours. Today 2020 match is there. That reminds me. Okay. 20 hours in case of tuberculosis. 20 minutes in E. coli. 20 days in lepra bacilli. Although lepra bacilli was discovered most earlier, it's called Hansen's bacilli, not Hansen bacilli. Hansen, Hansen's bacilli. It is cultivated in foot pad of mouse. Foot pad of mouse or 9-banded animal called armadillo. 9-banded animal called armadillo. So you should tell the difference. This much they won't ask, but sometimes if you start answering questions, they will start. First of all, you get stumped when you ask why they are acid fast. They don't remember. Sir. Thick cell wall, thicoic acid, magnesium. They start answering gram staining questions. So mycolic acid, you remember until December end. Afterwards, you can forget it afterwards. Okay. Now, next question they ask is LJ media cultivation tuberculosis, and there are some organisms which are called as commensal. There is Mycobacterium smegmatis. For example, in the urine, if you see tuberculosis, how to differentiate between Mycobacterium tuberculosis and Mycobacterium smegmatis? Smegmatis is a tubercle bacilli present in the smegma. So, Mycobacterium tuberculosis is both acid fast and alcohol fast. Acid fast and alcohol fast. But Mycobacterium smegmatis is only acid fast, not alcohol fast. Only acid fast, not alcohol fast. Now they'll ask you other methods of staining. Other methods of stainings are, nowadays we have got DMC, direct microscopic center. We have got one of the microscopic center, DOTS program, anti-tubercular drug is given. Now other methods is fluorescent staining. Fluorescent staining, the fluorescent stains that are used are rhodamine and auramine. Rhodamine, you remember with cricket players John T. Rhodes and Wasim Akram. John T. Rhodes and Wasim Akram. What happened? Sir, you're not feeling well. Not well? Sleeping. Feeling like sleep. Did not sleep well yesterday. What's wrong with you? Go and wash your face and come. Go. So they are stained with fluorescent dyes, seen under ultraviolet or fluorescent microscope. They fluoresce. So they'll ask this. And there is a cold methods of staining. Cold methods of staining are, you need not have to heat intermittently for 5 to 7 minutes. These are quinones and gabbets. Quinones and gabbets. These are cold method of where you increase the concentration of carbofuscin. You increase the concentration of carbofuscin. So, other methods of diagnosis of tuberculosis is growing in the culture, animal inoculation. You inject into guinea pig and sacrifice the guinea pig and look for the tubercle in various organs, lymph nodes and other things. Then finally you have RT-PCR. Then there is something called Cbme. CB stands for cartridge-based nucleic acid amplification test. Cartridge-based nucleic acid amplification test. Then there is a gene expert. It not only gives identification of tuberculosis, it also gives idea of rifampicin and isoniazid, resistance against rifampicin and isoniazid. So we had a tuberculosis control program and revised national tuberculosis control RNTCP revised national control program, and we have now we have started what is called as elimination program, tuberculosis elimination. Tuberculosis is very rampant. There is something called resurgence of India, resurgence of tuberculosis in 1984. Most of the HIV patients are infected with TB. Most of the, in fact, you have diabetes mellitus also and hepatitis B also. We have to treat so many at one point of time. Instead of food, we have to go on giving tablets. Morning, so many tablets, afternoon, so many tablets, dinner, lunch, breakfast, tablet. So many burden it is there. Why this tuberculosis problem is growing every day? Why we are not able to control tuberculosis, eliminate tuberculosis from India? Any guesses? Any guesses? All anti-tubercular and all HIV drugs are free. Free. All anti-tubercular drug, all retroviral drugs are free. But still we are not able to control or eliminate tuberculosis from this country. Why? Any guesses? Any guesses? Huh? Huh? Unawareness? No. Most of these patients are illiteracy. Number one, illiteracy. Number two, most of them are alcoholics. दारू पीते हैं सब लोग उधर. दारू बुरा है, is it not? Spirit lifts the spirit, no? दारू बुरा नहीं है, अच्छा है. एक बार तुम पी के आके एग्जाम में लिखो, बहुत अच्छा होता है एग्जाम में. Okay. So the most of them are non-compliant, because if you take properly anti-tubercular drugs for 6 months, you can eliminate tuberculosis from the lungs. But by the end of second week, they become all right. Somebody will tell, क्यों लेता है इतना drug? They are hepatotoxic, rhinotoxic, and all those things. They stop. They go to Ayurveda, homeopathy, naturopathy, Siddha, and they start doing yoga, all those things. Baba Ramdev, Shuddha nature ghee. सब लेते हैं वो ना. So tuberculosis is a very common. You come across each and every specialty of fevers. Whatever you become tomorrow, whether you become gynecologist, orthopedic surgeon, or whatever specialty is there, tuberculosis is there. Pardon. It infects almost all organs except hair and nail. It infects almost all organs except hair and nail. Okay. Tuberculosis, it is estimated that 10% of medical students by the end of their 5 years course suffer from tuberculosis. It is estimated that because these tubercle bacilli are rampant in the corridors of the hospitals where patients of tuberculosis are admitted. Only the tuberculous sputum will become positive when they shed 50,000 to 100,000 bacilli per ml of sputum. They are called open case of tuberculosis. They are called as open case of tuberculosis. They are called as open case of tuberculosis. And up to nobody knows etiquettes of coughing and sneezing, and all the people, you believe it or not, it's very difficult to practice medicine when you sit in the clinic. Now it looks very cool. And somebody is treating, somebody is auscultating, and you sit across the patient. When they get cough, they spit on your face. Sometimes they vomit on your place, and pre-surgical, if they don't give enema, and if they don't, they shit in the operation theater. These are all problems we come across when you start practicing medicine. Medicine is not very easy. It is, although it looks, when you wear apron, nice shoes, and all those things, you look very good. When doctors are, I mean, it's very difficult to practice medicine. Now we are all practicing that. What is safety in hospital practice? Wrong medication, pharmacovigilance, so many things we are doing. And what happens in earlier days, sputum, they used to put in one bin, what the surgical bin, so many sputums. Suddenly some nurse or Aya, or she used to drop that bin on the floor. She's scared. The moment he goes back and tells she has dropped, then she used to look up and sputum is all spilled. She used to see in which it is more, in which it, then she will mix up. Ramanna who is negative will become positive. Shamanna who is negative will become positive. So what happens ultimately? Shamanna without tuberculosis has to go on treatment for 18 months. Ramanna coughing and it will spread all over the hospital. So this is very important. Once I was sitting in the this is all personal. This all happened real. So husband brought a urine, saying that please do pregnancy test. Okay, and pregnancy test, you must have seen a lot of advertisement also, no? Double line repair, it's positive and all this. In the olden days, it was like latex agglutination test, human choreogonadotrophin. And I said, I was consultant, I mean, in Ramaya Medical College, my first job. If you go to Bangalore, you see Ramaya Medical College. Started in 7, I was the first to join the college. And I said, congratulations, you are going to have a baby. See, he started crying. I said, what happened? Sir, while coming, I spilled the urine. My wife is very quarrelsome. If I go back and ask urine once again, she'll start fighting. I said, no, Baba, cool down. It is a very sensitive test. Even if a drop of HCG is there, even nanogram of HCG is there, you go back, bring the fresh urine sample, I'll do it again. Again, he went back and brought his wife's urine. Again, he gave a new bottle and it was positive and he was very happy. So these things are very happens. And most problematic comes is HIV patients, no? HIV patients, when you do oh madam, क्या चल रहा है? गुफ्तगू क्या चल रहा है? क्या बात कर रहे हो? हमें तो भी शामिल करो उसमें. I want to participate in your conversation. क्या चल रहा है? Nothing. What is it? Something? डरो मत, कुछ नहीं करता मैं. दारू दारू पीने से आदमी का लिवर खराब हो जाता है. क्या होता है? वैसे तो हम दारू नहीं पीते. दोस्त की शादी में गया था, 2-3 बॉटल चढ़ाया. वेरी फेमस डायलॉग ऑफ सत्ते पे सत्ता, अमिताभ बच्चन. अदर फेमस डायलॉग, वैसे तो लड़का सीधा साधा है, कभी कभी दारू पीता है, जुआ खेलता है, उसका खानदान को आता पता नहीं, खानदान पता चलते हैं, मैं शादी पक्का समझू. फेमस डायलॉग ऑफ शोले. So I am a die-hard fan of Amitabh Bachchan. Actually, I met him 3-4 times in Bangalore. He was my favorite hero, in fact. Okay. Heroine Madhuri Dixit. She's a microbiologist. You know that? She's MSc microbiology. Madhuri Dixit. She wanted to become MBBS doctor. She did not get seat. She joined MSc microbiology. And she was in Mumbai KM Hospital. So when I was in Mumbai, I have seen her as a MSc student. Okay, don't worry. She was like any order. See, film actors, they become stars when they appear on the screen. They are like just like all of us. Even if you're take acting, if you become successful, you will also become star. Kamal Hassan, yes, yes. You must have heard about one, Sudeep Kicha. He was my student in engineering. He was in engineering college. You, you will not believe. You never believe. Also, I have scripted at least 4 or 5 movies, lyrics and story लिखा हूँ, and all the movies are runaway hits. And because of NMC and MCI restriction, the doctor should not share the names on the screen. Upendra is not good. He's very bad. I don't like him. Upendra is a very good friend of mine, but who? Shivanna is a very bad actor. See, whatever said and done, this Akshay Khan, Shah Rukh Khan, and Ajay Devgan should be booted out. They are our models and advertise for gutka. They should not do. They are our models. Even Amitabh Bachchan, we respect him so much. He also some gutka is advertising. They should not do for such a cheap jerks for this. They should not do. Appu was advertising for Nandini milk, and he was running some charitable this thing for so many schools, educating girl students. So very charitable work. It all came out after his death, unfortunately. And he was very nice person and okay because he used to do a lot of exercise. Basically, I think he suffered from COVID in the past and suddenly he died. COVID myocarditis, something like that, by the time. So very important. Tuberculosis. Said something. What is that? So briefly, I'll tell about tuberculosis. Tuberculosis, man get infected by inhalation, and first there will be small lesion. It is called as Gons focus, and with or without treatment, it is called primary tuberculosis. It heals off. It is called gone focus. So reactivation occurs in the later part of the life when man becomes immunocompromised, when he becomes smokers, when he suffers from viral infections. That is called reactivation of tuberculosis. There is a cavity formation, central area of caseation necrosis surrounded by monocyte macrophages. This becomes fibrous tissue and all caseous matter is coughed out. It gives rise to cavity. And sometimes it spreads to pleura. It gives rise to pleural effusion. And through the blood, it spreads. It is called miliary tuberculosis. Miliary tuberculosis. It grows to the brain and gives rise to tuberculous meningitis, and it also gives rise to space occupying lesion called tuberculoma, and it goes to the brain, it goes to the bones, it goes to tuberculous osteomyelitis, it goes to the kidneys, it gives rise to renal tuberculosis. Neat question about renal tuberculosis. Everybody, acid, sterile, pyuria. Acid, sterile, pyuria. Acid, sterile. But 70% of cases it is pulmonary tuberculosis. Another 30% is extra pulmonary tuberculosis. BCG. What is the long form of BCG? Bacillus, calamite, urine. Bacillus, calumet, and gurine. Bacillus, calumet, gurine. It's a bovine strain of live attenuated vaccine. It is given in the deltoid region subcutaneously, and it gives rise to immunity against tuberculosis. Although they say that question mark immunity, but it is given immediately after birth. On the 0 day, we administer oral polio drops and BCG, and 6th, 10th, and 14th week, you will give pentavalent vaccine, DPT, hepatitis B, and Hep B, and oral polio vaccine. Okay, tuberculosis, BCG is live attenuated vaccine, bovine strain of tuberculosis given to protect against tuberculosis. To test whether the person is immune or susceptible to tuberculosis, we do what is called as Mantoux test. What is that? Mantoux test or tuberculin test. What is that? Tuberculin test. Mantoux test or tuberculin test. 10 ppd or 0.1 ml of and 5 ppd in pediatrics, given in the flexor surface of the forearm intradermally. What? Intradermally. It is given in the intradermally, 0.1 ml of tuberculin, purified PPD. It is also called as PPD, purified protein derivative. Induration, everybody, induration, thickening after 48 to 72 hours suggests the person is already had tuberculosis in the past, exposed to tuberculosis in the past, and if there is large ulcerative necrotic lesions, it is used as a diagnostic tool in rural areas where diagnostic and microscope and X-ray facilities are not available. Tuberculin is the most often asked question. Tuberculin, BCG, Ziel-Nielsen staining, and pathogenesis of tuberculosis, various forms of tuberculosis, often asked question in your examination. The essay questions, 9 questions I have put up in the your group, and please see that all of you practice that 9 questions, write answer for them, once seeing the book, once without seeing the book, and memorizing. Our group discussion, become one of you, Aditya, you become teacher, teach of 5 of you, okay, tell them, and it's good practice, it's a good practice. And I said you should, even if you don't have roller board like this, you should buy a slate and chalk piece, write it and explain to your friends. Oh, this is the tuberculosis. So whatever language, in Telugu also can teach. Kannada, if somebody knows, I can teach in Kannada also, no problem. I used to teach. So whatever language you are comfortable, you can teach or understand the subject. Okay. Once you understand, you become confident. Thank you all. You are going to do Ziel-Nielsen staining today. It's one of the important exercises for the university exam. Here onwards, 4 to 5 will be practical hours. Every day you will do some practicals. The applied exercise, gram stain, Ziel-Nielsen stain, spotters, stool examination, all those things which are required for you to get distinction, not pass, distinction. Thank you.